Thank you for joining me today. We are going to continue and learn more about the psychopharmacology. We want to continue for mood stabilizer. This is the second video. You can watch the first video of the psychopharmacology. And we are going to continue mood stabilizer. We talked about lithium in the first part of the psychopharmacology, and we are going to continue in this video. Please join me and prescribe, and thank you being here. So second mood stabilizer is a valproate. Valproate mechanism is enhances GABA aminobutyric acid activation. It is indicated for acute mania and bipolar maintenance. Valproate. When you prescribe valproate, you want to monitor the liver function. You want to monitor the platelet count, and you want to monitor the drug level. Valproate major side effects include weight gain, liver toxicity, and pancreatic inflammation. For pregnancy, it has a high risk for fetal. So it's not described for pregnancy women. Third mood stabilizer medication is a carbamazepine. Carbamazepine is indicated for bipolar disorder, mania, and you want to monitor complete blood count and liver function. Side effects include blood dyscrasia and drug interaction. Drug-to-drug interaction. The fourth mood stabilizer is lamartine, and it is indicated for bipolar depression prevention. However, side effects include Stevens-Johnson syndrome, which is rash in the skin or skin irritation. Prevention is slow titration. Prevention is slow titration. Now we want to explain antipsychiatric medication. First generation antipsychiatric medication mechanism is that they are a strong blocker of the dopamine D2 receptor. Example of first generation antipsychiatric medication include Haldol, carbamazepine. Their side effects include increased extrapyramidal syndrome, which is muscle movement disorder. They cause acute dystonia, akinesia, parkinsemia, tardive dyskinesia. So first generation antipsychiatric medication is they cause acute dystonia. That as acute dystonia can be treated anticholinergic medication. They also cause akathisia, and that can be treated beta-blockers, which is the blood pressure medication, and you can reduce the dosage. First generation antipsychotic medication, because they strongly block dopamine in the D2 receptor, they cause Parkinsonian symptoms. Those symptoms are rigidity and tremors that mimic the patient have. It mimics like a Parkinson, but it's not Parkinson. It's the side effect of the antipsychotic medication. First generation antipsychotic medication also causes tardive dyskinesia that involves involuntary movement. However, that was the first generation antipsychotic medication. However, second generation antipsychotic medication blocks dopamine less than the first one, and it blocks dopamine D2 in the D2 receptor, and also it blocks serotonin in the 5-HT2A receptor. Second generation antipsychotic medication include Risperdal, olanzapine, Seroquel. For example, Risperdal has a risk of prolactin elevation. Olanzapine or Cyproxa has a risk of increasing appetite, increasing weight, and metabolic dysfunction. It increases the weight, that leads to increases of the blood sugar, lipids. So you want to monitor the weight, you want to monitor the blood sugar, you want to monitor the lipid, hyperlipidemia, because it causes metabolic metabolic syndrome. Seroquel is used for schizophrenia, bipolar depression, agitation. Erbabrazole or Abilify. Erbabrazole or Abilify is second generation antipsychotic medication that partially blocks dopamine, and benefit is it has a less weight gain compared to others, so it causes less metabolic syndrome if the patient is overweight and if they have diabetic or hyperlipidemia. Abilify is better for that way. It's better for that person to be prescribed for. Other second generation antipsychotic medication is a clozapine. Clozapine treatment resistant schizophrenia, and it's unique it reduces suicidal ideation. However, you want to monitor absolute neurophilic count, and you want to monitor metabolic. It lowers the white blood cell absolute neutrophilic that increases the infection. So you want to monitor that. Now we want to explain more about the anti-psychiatric, anti-anxiety medication. Anti-anxiety medication include the benzodiazepine, like the lorazepam, diazepam, clonazepam, benzodiazepine. Benzodiazepine increase GABA. Benzodiazepine is used short term for panic disorder, acute anxiety, acute alcohol withdrawal, short term, because it has the risk of a dependency, risk of a tolerance, risk of a fall, risk of cognition impairment. Because of all these risks involved, benzodiazepine is used only short term for panic disorder to calm the person, acute anxiety, acute alcohol withdrawal, short term, so the patient not develop dependency, tolerance, falls, and cognition impairment. Other anti-anxiety medication is buspirone. Buspirone mechanism is partial agonist, serotonin partial agonist, and it acts on 5-HT1A receptor of serotonin, and it's partially agonist. It used in general anxiety disorder. Buspirone do not create dependency, so its patient can use longer time compared to benzodiazepine. So the benefit of using buspirone for anxiety is that don't create a dependency. Hydroxyzine or visceral, other name, mechanism is antihistamine activation. It used short-term anxiety relief. Now we want to go ahead and explain stimulant medications. Stimulant medication treat ADHD. Stimulant medication include methylphenidate, and methylphenidate blocks dopamine transport, neurotransmitter transport. Methylphenidate stimulating medications include amphetamine and methylphenidate. Amphetamine and methylphenidate. Amphetamine and methylphenidate. So methylphenidate blocks dopamine transportation and neurotransmitter. Amphetamine blocks also and increases dopamine release and norepinephrine release. You want to monitor the blood pressure for amphetamine and methylphenidate. You want to assess the blood pressure, heart rate, weight gain, appetite, and sleep. Side effects and risks are misuse. People misuse methylphenidate and amphetamine. They create dependency and tolerance. They create psychosis. Next, we wanted explain more psychiatric medication. The first line selection. First, major depression disorder. For major depression disorder, first line is SSRIs or SNRIs for major depression disorder. You want to evaluate the response for 4 to 8 weeks. After you prescribe the medication, you want to evaluate the effectiveness because it takes time for 4 to 8 weeks. Partial response. If they have a partial response, you want to increase the dosage. Or you want to add other medication if they have a partial response. However, if there is a treatment resistant, you want to consider lithium, adding lithium. You want to consider a typical antipsychotic medication. You want to consider adding esketamine. You want to consider EKG therapy. You want to also consider repetitive muscle magnetic stimulation. For bipolar disorder with acute mania, the first line of treatment is lithium, valproate, and second generation antipsychotic medication. For bipolar disorder with depression, options include lithium, lamartine, Seroquel, Lunesta. Schizophrenia, first episode, first line of treatment is second generation antipsychotic medication, and you want to assess the adhesiveness, if the patient is compliant with the treatment, if they take their medication, because if you are not taking your medication, you will not see any changes or any effect. Then you want to consider long-acting injection, antipsychotic long-acting injection, because that improves the medication adherence. If the treatment resistant still continue and the patient is still having that side effects or symptoms, you want to consider clozapine. Psychotropic medication monitoring guidelines include SSRIs. You want to monitor suicidal ideation and serotonin syndrome. For SNRIs, you want to monitor blood pressure. Lithium, you want to monitor lithium level, kidney function, and thyroid function. Fulbrate, you want to monitor liver function and platelet count. Antipsychotic medication, you want to monitor the weight, you want to monitor the glucose level, diabetic, you want to monitor the blood glucose, you want to monitor you want to assess the A1C, you want to also monitor liver level. You want to monitor clozapine, you want to monitor absolute neutrophilic count. Stimulant medication like amphetamine, you want to monitor the blood pressure, you want to monitor the heart rate and weight gain. Patient with depression, you must screen for bipolar disorder before prescribing antidepressant medication, because if the patient has a depression and you didn't rule out bipolar disorder and you give antidepressant medication can worsen a manic episode. So you want to rule out if they are having bipolar depression or if they are having just the depression. Second rule is patient on a lithium requires kidney and thyroid monitoring. Third rule is patient taking clozapine require absolute neutrophilic count monitoring. That is the third rule to remember. There is 5 rules you have to remember when you are prescribing antipsychotic medication. And those 5 rules are: first rule is patient with depression must be screened for bipolar disorder before prescribing antidepressant medication, because antidepressant medication can worsen manic episode. Second rule is if the patient is on lithium, they require monitoring kidney function and thyroid monitoring. You have to monitor the kidney function and thyroid function. Third rule to remember is patient who is taking clozapine requires absolute neutrophilic count. Fourth rule to remember is second generation antipsychotic medication requires metabolic monitoring because they increase the weight, increase the appetite, that increase the weight, that increase the blood sugar, and that increase the lipid. So you have to monitor the metabolic. panel. 50 rule to remember is benzodiazepines are usually used short-term treatment because of the dependency and tolerance risks. So patient taking lithium developes. This is the case study. Patient taking lithium develops tremor, confusion, and vomiting. Wow, that's high. They are having a tremor, they are confused, and they are vomiting. Which lab test is most important? Which lab you have to assess if the patient is vomiting and they confused and they are having a tremors and they are on lithium. Patient is on lithium. They begin vomiting, confusion, and tremors. What would you do? Do you assess the thyroid stimulating hormone? Do you assess lithium level? Do you assess vitamin B12? Or do you assess the A1C? Lithium don't cause A1C elevation. It don't cause blood sugar to be high or low. Vitamin C, I don't see any way it can affect vitamin B. Lithium don't affect vitamin B, so why would you assist? You want to assess lithium level. And the reason is these symptoms suggest lithium toxicity. Second question. A patient is receiving antipsychotic medication and they develop fever, rigidity, altered mental status, and elevated creatine kinase. What is the diagnosis? I will take time to you figure out that. They are having a fever, rigidity, mental changes, and creatine is increased. What diagnosis that causes all that? What diagnosis causes the fever, rigidity, mental changes, and increased creatine? That is a neuroleptic malignancy syndrome. So neuroleptic malignancy syndrome causes fever, rigidity, mental changes, and creatine elevation. So, advanced psychopharmacology require integration of the brain biology, neurotransmitter, medication mechanism, clinical response, and safety monitoring. Clinicians must understand pharmacokinetic, pharmacodynamic, receptor system, medication classes, advice effects, monitoring reasons, patient education. The goal is choose the right medication for the right diagnosis while maximizing the benefit and minimizing the harm. Thank you for joining me today. Please subscribe and join me again. Give me your feedback. Tell me what to improve. Tell me what do you like about my videos And what do you don't like my videos? What can I improve? How can I improve? Give me feedback, prescribe, join me, and thank you very much being here.